Welcome to your most favorite channel, Heartbeat. My name is Dr. Amrit Kejriwal. This channel is mainly meant for MBBS students, postgraduates, medical professionals, and all those who may find it a bit more easy. It is an attempt to make the complicated medical sciences more simplified and easier for understanding.
Today we'll learn about electrocardiography, the PR interval. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Coming to the PR interval, it represents depolarization of the heart from the SA node through the atria to the AV node. It is measured from beginning of the P wave to the beginning of the Q wave, or if Q wave is absent, then beginning of R wave. It varies with the heart rate and is shorter at higher heart rates. Now coming to the PR interval. Interval as per definition is equal to wave plus segment. PR interval is equal to P wave plus PR segment. So here is the beginning of the P wave and here is the beginning of the QRS complex. And duration is 0.12 to 0.2 seconds. So here is the PR interval. Over here you can see this blue line. There are various varieties, conditions in which you get shortened PR interval, prolonged, variable, and cannot be measured. Just go through them. So short PR interval, it can be due to pre-excitation, commonly seen in Wolff-Parkinson-White syndrome and LGL syndrome. In the Wolff-Parkinson-White syndrome, you have a short PR, delta wave, wide QRS complex, tall R wave. You can see over here. This is the delta wave, broad QRS complex, and a short PR interval. So this is the delta wave, and in the WPW, as the impulse travels from the SA node to the AV node, there is abnormal conduction from the atria to the ventricles. There are various pathways in which they can conduct, and depending on the ECG, we may also be able to detect which pathway is abnormal. In the LGL pathway syndrome, the impulse gets conducted from SA node to AV node, and there's an abnormality in the AV node in which the impulse gets conducted faster, and so it is not associated with a delta wave or a broad QRS complex. Short PR interval can be seen in other conditions also, such as AV junctional rhythms, ectopic atria rhythms originating near the AV junction, or it can be a normal variant. You can see over here. Yeah, see, this is a short PR interval. Prolonged PR interval, that is greater than 0.2 seconds, can be seen in high vagal tone. Use of beta blockers, hyperkalemia and hypokalemia, acute rheumatic fever, and carditis with Lyme's disease. So over here you're getting a prolonged PR interval greater than 5 small squares, prolonged PR interval. Prolonged PR can be seen in other conditions also: first degree heart block, second degree AV block, MOBITIZ type 1 Wenke-Becks, MOBITIZ type 2, and third degree heart block. In this particular ECG, we can see the prolonged PR intervals, which are almost constant from ECG to the ECG. These blue lines represent the PR intervals, which is quite prolonged. Now there is also a variation of these PR intervals, which you can see in second degree heart block and third degree AV block. In Wenke-Becks phenomena, type 1 has PR intervals are progressively longer until a QRS complex is dropped and then the cycle repeats. So you can see over here the PR interval is short, gets prolonged, and then there's a drop. Again this is short, long, then drop. So all the blue lines represent the PR intervals and the green line represents where the QRS complex has dropped and the PR interval cannot be measured in these places. And you can see with the blue lines the PR interval gets progressively prolonged. Second degree AV block, MOBITIZ type 2, PR interval is constant and there is sudden absence of the QRS complex. So you can see the PR intervals are constant and here is the QRS complex which suddenly drops, sometimes after 5 beats, sometimes after 3 beats. Sometimes the dropping of the QRS complex may be quite regular. So in this MOBITIZ type 2 I've drawn a diagram of 3:2. So you can see the P waves in the blue line. The place where the QRS complex is dropped, green lines, and the QRS complex are shown in the red lines. So we can see that every 3 P waves has 2 QRS complexes. So this is a 3:2 block. Not measurable, third degree AV block, the PR interval is not measurable. The P waves are shown in blue and at places they have merged with the QRS complex or the T wave shown in red. Here is the T wave, here a P wave has merged. Again the next P wave has merged with this QRS complex. Here another P wave has merged with the T complex, T wave, and over here merged with the QRS complex. And again here another P wave has merged with the T wave. So it gives varying morphology of the QRS complex wherever it's merged, and T wave also has a varying morphology wherever it has merged. You get a variable PR interval. In wandering atrial pacemaker, the pacemaker site moves from beat to beat, causing the P waves to appear different and the PR intervals seem to vary. So over here you can see the PR interval, you can see the PR interval over here. Over here it's very short and it's not variable PR interval and it's not possible to measure all the time. Absent PR intervals occurs in atrial flutter and filtration. P waves are not formed, we can't see any clear P waves and baseline is not seen. So in such patients you cannot measure the PR intervals. Again, PR segment depression can be seen in atrial injury and pericarditis.